let's talk about something every dental hygienist deals with: how to manage your time and adapt to different types of dental patients during an appointment. Hi everyone, my name is Whitney and I'm a registered dental hygienist here to talk about adapting to different dental patients. Now, we dental hygienists, we all know not every patient is the same. Some are total perfectionists, those easy prophy patients who barely have any buildup. They follow all their home care instructions to a T. Others, not so much. They might be struggling with their home care routine, or maybe they've just never had a provider who took the time to motivate and guide them. That's where we come in. So today, I want to talk about how to give your dental patients the most in 60 minutes, the 60 minutes you have with them, or even if you're working with 50 or 45-minute appointments. Anything less than that, unless you're doing assisted hygiene, thanks. But even if you're lucky enough to get the full 60-minute appointment, if you have a difficult patient with heavy buildup, it can still feel like a time crunch. So here's a few ways to make every minute count. Because truthfully, whether we see someone 2, 3, or even 4 times a year, that hour together can be crucial for setting the tone for everything they do at home in between appointments with you. So first, how to adapt to the patient in your chair. Like we said, not everyone needs the same thing. Some patients have a super easy appointment since they're already doing everything right at home and they're just here for the maintenance. But even still, with these easy appointments, use that time to dig a little deeper. Maybe review their habits, update any OHI, check in on sensitivity, recession, dietary risks, check their blood pressure, evaluate any airway assessments, ask if they are ever clenching or grinding, or if they snore, things like that and more. In addition, you can always simply ask, do you have any questions about dental health? Sometimes I ask that, and well, more and more of my patients are starting to know I have a YouTube channel, so they ask some very specific questions about fluoride and root canals, all the misinformation, controversial stuff that they've been hearing about online. And if you open the floor to questions about anything, but you don't feel comfortable answering, of course, not to plug my channel, but you can always send them here. But also, you know where to find resources. You know where to find credible websites to send them to if they want extra information. So always help them find those trustworthy, accurate resources. But when you ask that question, do you have any questions about anything dental? Sometimes they will ask very simple questions like, hey, yeah, you know what I've always wondered? I've always wondered what the air does. Why do you blow the air on my teeth? Or what's the best toothpaste for my mouth? Simple product awareness is everything. Be there for your patients to answer any and all questions they have. So that was the easy, super clean, barely any plaque prophy patients. Then there's the patients who really need more from us, even more. Not only education, motivation, guidance, but also some serious technical skills in the chair, right? When we're scaling their teeth to properly remove all the plaque, calculus, and stain from their teeth. But here's the thing, where lots of hygienists, especially new hygienists, tend to get tripped up. Oftentimes, they're so focused on their hand instrumentation skills, scaling techniques, right? Again, I was too. So maybe you're doing a beautiful job cleaning the patient's moderate to severe buildup, making their mouth perfectly clean, although they're a difficult patient, but then they come back in 3 months and it's a full mouth of calculus again. So remember that although we can do a great job cleaning their teeth, maybe we can fix the issue so they don't keep coming back with all that buildup. To do that, assessing their home care is key. Maybe they say they are brushing and flossing daily, and they are, but they unknowingly are struggling with flossing, or maybe they're not brushing long enough for the full 2 minutes. This is your time to connect with them, empower them, and educate them. I just had a situation recently where I realized every single time the patient I was seeing, they had so much buildup every single time. So I was finally like, hey, let's figure out what's going on. How long do you brush? Is it the full 2 minutes? And they looked at me and they said, no, I had no idea. You had to brush for 2 minutes, maybe 30 seconds at the most. Y'all, that was on me. I've been seeing this patient for almost 2 years now, and I never thought to ask that question. I just assumed everyone knew you're supposed to brush for 2 minutes every single time. But no, never assume. Because guess what? 6 months later, after explaining how important it is to brush for the full 2 minutes, he came back with significantly less buildup on his teeth. So having said all that, one of the best time management tricks is don't wait until after scaling to do all your oral hygiene instruction. That can eat up your clock real fast. Instead, talk to them while you're scaling. If you're seeing bleeding in specific areas, point them out during the cleaning. And if they have buildup in the same quadrant every single time, mention it while you're there. It's real-time customized feedback, and it doesn't slow you down as much as wait until the end of the appointment to discuss home care. I will say also something that will save you time in the long run. It's hard to implement this the initial time you see them, the initial appointment, because you're like, oh no, 5 minutes of something takes away 5 minutes of my scaling. But that 5 minutes minutes of education can decrease the amount of buildup they return with the next time from improving their dental health at home. It will be worth it in the long run, right? So whenever I have a patient who is struggling with buildup, so much calculus, bleeding gums, we did the SOP and we've been doing perio maintenance, or maybe it's all super gingival and they just build up without any sub-G issues, like the story I just told you. Whatever the case, I always have them brush and floss their teeth in front of me so I can see where they might be going wrong or doing something wrong at home. You'd be amazed at how many people are using the seesaw motion instead of the proper C shape, wrapping, hugging the tooth up and down with flossing. I will link my proper flossing video below, as well as my electric toothbrush versus manual toothbrush videos. All my tutorial videos will be linked below, and you could also find them all in my free oral care guide. It's all linked below. Anyway, my point is, if you can fix how they floss, for example, and now they are actually flossing correctly, removing debris from between their teeth, next time you see them, next time they come in, you might be surprised at how much better their teeth look. And if they use a water flosser or a specific electric toothbrush, again, have them bring them to their appointment so they can demonstrate for you how they use them at home. So then you can assess whether they are using their home care tools correctly. By the way, that patient I mentioned earlier about the 2 minutes of brushing, he was someone who only wanted to use a regular toothbrush, so I did the whole thing, making sure he's using proper technique. I watched him brush his teeth very well. He had good technique. That's what I was trying to figure out. And then I found out, although he had fine technique, he was so quick. He wasn't spending enough time in each quadrant. So you gotta play detective a little. Investigate what can be going wrong at home. Is it that they are using poor technique, or is it simply that they are not staying on routine and they're skipping nights? They're not brushing and flossing daily. If it's the latter, that they are struggling with consistency, something that's really helpful regarding consistency and routine building, it's called BetterMouth. It's a free app that helps patients build home care habits. There's a streak tracker so they can literally show you their brushing and flossing history. Great for patients who like data or just need a little accountability. There's also a gamified aspect to it. Some people just need that extra motivation. BetterMouth often offers challenges such as floss for 30 days and be entered to win a gift card, stuff like that. Anyway, I've been telling all my patients about it since it can only help, it can't hurt. Even the easy prophy patients tend to like it. But yeah, it's like extending your reach beyond the operatory. You're only with them for a couple or a few times a year, but with BetterMouth, it's keeping them on track every single day in between. You can find the free app in the App Store, and I'll also link it below if you're interested in checking it out yourself before recommending it to your patients. I am the oral health advisor on the app, so y'all know everything is evidence-based there, and I'm proud to be associated with it. So in conclusion, if you finish scaling early because someone was an easy cleaning, it doesn't mean it's time to zone out or wrap up early. Use those extra minutes wisely. Educate, build rapport, do a little dietary counseling, ask if they have any questions, concerns, comments. Look for early signs of disease, not just the teeth and gums, but check out the back of their throat. Do a comprehensive oral cancer screening, intraoral, extraoral, show them their x-rays, point out areas that they can focus on at home. Even with perfect patients, there's always something you could do to add value. They'll remember that extra effort. And for the patients that have more buildup and are, for lack of a better word, considered more difficult cleanings, again, time management is key. Be sure you're educating while you're scaling, multitasking, right? And take the extra 5 minutes to assess their home care, because then you could potentially save yourself more time in the future if you're able to fix their daily home care techniques. And one more thing, a fun side note. My husband, who hated flossing for the longest time, he now does it daily. Obviously being married to a hygienist, right? Probably helped a lot. Especially that I make these videos here and I'm hardcore dental hygiene, everything. But what really made it stick was the mindset shift. He said that it's like exercise to him. He still doesn't love doing it, but he gets why it matters. So he powers through it because he knows it's worth it. He even uses the BetterMouth app and records his streaks, and now we compare ours every day. It's kind of fun. We make it fun. It's part of the routine now. So no matter how much time you have, whether it's 60 minutes, 50, 45, make it count, because those few times a year that you see someone might be the only dental touch points they get for home care improvements. Consistency beats trends. Real talk beats scripts. Be a human, talking to a human. And small moments of education can lead to big changes in someone's health. Give your patients the most every single time. You got this. Thank you for watching. This was a long one. I hope it helped you. Please like, subscribe, and turn on your notifications if it did. Share it with your hygiene friends, especially if you're a new hygienist. And if you want even more teeth talk, you can visit my website, teethtalkgirl.com, and join my newsletter for weekly dental health emails. Everything is in the description box below. And until next time, I'll see you on Instagram at teethtalkgirl. Peace, love, and teeth.